Welcome back to MontyTV. I'm sitting down now with Patrick Quigley. He's the CEO of Katch. Today we're talking about healthplans.com, one of the businesses owned and operated by Katch. Patrick, thank you so much for joining us.
Well, thanks, Jackie, for having us.
I wanted to talk with you first about health insurance. It's such a confusing, battlefield for people navigating. How does healthplans.com help people see through all of that?
Yeah, absolutely. I think to understand how we help folks get healthcare, I think it's better first to understand kind of what are the changes that Obamacare has made to the purchasing and marketing of health plans, because that's where the health plans business really kind of started out of. And there was really three things that Obamacare has changed. First, all of a sudden you have companies like Cigna and Aetna marketing health plans direct to consumers, when normally people would get their plans through employers. So now suddenly they're direct marketers. With 11 million people buying plans through the exchanges in the last year, that creates a real need for Aetna and Cigna to break through the noise. So that's kind of the first change. The second change that really kind of affects things is that healthcare suddenly is a consumer product. I don't know if you have been through Walmart, but there's actually stands in Walmart where when you're done buying your toothpaste and cleaning supplies, you can turn around and purchase health insurance at a Walmart, which is a little crazy if you think about it. But so now you've got Obamacare causing health insurance to be a consumer product. And then the last thing is the government is the primary merchandiser of this product. And I don't know if you've had a chance to go to healthcare.gov or any of the state exchanges.
How does healthplans.com kind of become, I guess, the Zillow for healthcare?
A little bit. I think more we're really just trying to be an authoritative site to kind of address the issues that consumers see with his purchasing plans. And so what we do for the consumers, the first thing we do is we try to enable the consumer as they're shopping to know what their choices are. Again, if you go to the government websites, you have to go through 46 steps to know what your plan choices are, and that's not what a consumer's looking for. Last year we had 7 million people kind of come through healthplans.com and purchase health plans, and they just want to know what their choices are. So we try to make it easy for them to get to those choices very, very quickly. And then as we head into next open enrollment, we are rolling out kind of new features which allows the consumer to effectively know what the cost of that plan is. And I'm not just talking about the premium, I'm talking about loading up who their doctors are, what their drugs are, what their usage patterns are, and really getting to what we're considering a total cost of a plan for the consumer. And that's the vision for the consumer that healthplans.com is so that consumers can come in, really load up all their information and get a price and make an informed decision about their health plans. Does that make sense?
Yes, that makes sense. So we're experiencing a kind of a disruption in healthcare. What would you say is the price tag on the future market?
If you think about it, if you look at what the Obama administration has said, there's these 40 million or plus uninsured folks that are actually coming into the marketplace for the first time to get insurance. Previously, pre-existing conditions prevented that community from getting health insurance. It's also very expensive, so there's subsidies that's creating a lot of discussion with the Supreme Court right now. But the subsidies also enable health insurance to become more affordable for the first time. So you have 40 million people coming in. You also have the effect that Obamacare made it so that companies that have less than 50 people actually don't need to provide health insurance because people can go to the exchanges and buy it directly. So you really have a community where a very large percentage of the US population is starting to shop for insurance. So what's the size of that marketplace? I can't tell you, off the top of my head, but in terms of the opportunity, we're just starting out. And it's, obviously health insurance is a multi-billion-dollar industry, and the marketing of those plans is equally large.
That's such a valuable asset in this market because it's, like you said, and like we spoke about in the beginning, it is a really confusing subject for a lot of people. Where do you see healthplans.com going forward?
Well, I think right now it's all about product development. I mean, we are constantly investing in delivering better tools for the consumers. Really last year, as we went through open enrollment, we focused on choice, simply simplifying that 46-step process into a 4-step process. So that was what last year was about. So this year is about, hey, how do we go ahead and make it a more informed choice? How do we integrate in the drug data, the doctor data? How can we take into account the usage of a health plan to really provide what we're calling, all-in pricing or total cost of ownership for health plans? So that's what our product plan is on the consumer side. On the advertiser side, it's how do we make the tools even easier for the health plans to spend money? And we had a great open enrollment which just ended just a few weeks ago. And many of the plans that we work with have said that, hey, we're reallocating spend from Google to you guys because we're getting a better return and you're easier to use. And so we need to continue to keep that product lead. Otherwise, marketing dollars are finicky. They're going to go with wherever things work. So we have to continue to move the product ahead on both sides.
Thank you so much, Patrick. And you can catch more of Patrick Quigley on his website, healthplans.com.
Great. Thanks very much, Jacki.